You're welcome. You're welcome. Thank you for joining us this evening. You're welcome. Good evening. Good evening. Um, Good evening. You're all welcome. But yeah, we have our wonderful guest. You're welcome, Dr. Osawe.
Hi, thank you. Thank you for having me. I really, really appreciate it. Means a
Thank
lot.
you. Yeah, great, great. I think some people are still joining. Let's give them like a minute to join us. Then we kick off.
Okay, I'll be just blank for like 2 minutes. I'll be right back. Thank
Okay, no problem, no problem, no problem. Yeah, thank you for joining. Please share with your friends and families to join us. I believe it's going to be a wonderful time. For those that joined before and went off, I'm sorry. I was playing a music that I think Instagram flagged it for copyright purposes, so I had to stop that. Okay, so no music, so we don't have any copyright issues. Um, but yeah, we'll start off very soon. Thank you for joining. Thank you for joining. Are you back,
you. Yes,
Doctor?
I
You
am.
back?
Can you see me?
Yeah, I can see you.
Wonderful.
Great,
Thank you.
great. Okay, thank you for joining. Good evening. Um, I see a lot of people, okay, have joined early. Let's just give 1 more minute, just 1 minute more for those that are still trying to figure out how to use Instagram, and
Yeah, I'm still trying to send some link actually. So,
okay, 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 great, great. Are you ready? I think we can kick off. Um, Others will be able to join us later on, and we'll save the video surely, so that people that are not here with us can watch later on. So we can start. Are you ready, Doctor?
yes, I am. I'm ready.
Okay, great, great. Once again, I want to welcome everyone to Matters Arising, a time where we discuss trends and timely topics that affect Christian young adults. And the topic we've picked today is stress. So our discussion topic is stress. Let's break up. And we have a wonderful friend and an experienced doctor, and who has been doing a great work in this aspect. I've seen her work talking about stress, educating people about stress, and I thought I should invite her to talk to us about this very important topic. And this is a topic that affects everyone, right from your teenage years down to um, when you've aggregated some age. So it's it's something we should talk about. Yeah, but I'll let her introduce herself first before we start. So once again, Dr. Sari, please introduce yourself.
Well, thank you for having me. My name is Faithful Osawe, Dr. Osawe. I'm right now a second year cardiology fellow. I started about a year and a half ago. I finished next year. Prior to that, I actually practiced as a hospitalist and a teaching attending physician for 3.5 years, which was great. I really enjoyed it. And during that time, I had a opportunity to mentor residents. I actually worked as a mentorship. I was actually director of mentorship, and it was great because I was able to like connect to a lot of people, and that was where I started to realize how much stress affects us a lot. And so even more than that, more of the things that even as a fellow, I started to see real with me in my own life. And so more thinking about what I wanted to do, my purpose, I figured that this is something that even if I'm busy with my fellowship, I wanted to just start doing, not just doing it in a small way, but in a way that more people could actually benefit. So I started I'll say a talk about 2 months ago called Dr. Osawe Small Bites, where once in 2 weeks we talk about anything health or even just things affecting us as individuals, from like young people to older. And I realized how much people have really benefited from that, and how I get questions that have even benefited me myself. So this is where I am right now, and I'm looking forward to the future. Yeah.
Great. Great. Thank you. Thank you. I didn't know you're a director of mentorship. I should have enlisted in your mentorship program. But it's great to have you. And please, for those of us online, you are free to join the discussion, leave a comment, or if you have any question for Dr. Sawe, please feel free to ask. I believe we'll be able to answer your question tonight and clear any doubts that you might have as regards this topic. So let's start by defining what stress is. So how would you define stress, Doctor?
Oh, well, stress is actually a body's emotional and physiologic response to either a condition or an event that the body experiences. So it's actually, thinking about it in a full way, it's not really always a bad thing. So it's actually our body's response to events or conditions that happen. And so that's what stress really is. And I can elaborate more on that as we go, but honestly, stress really is a good thing acutely, because the body has been sent, alarm goes up in the body whenever something happens that is kind of not normal for our body, or that's not a regular thing for us. So we respond by the alarm system goes up, and our body makes things like cortisol and adrenaline and things that help to increase setting response to neurotransmitters in our body. So that's really what stress is, you know.
Okay. Oh, okay. That's great. So I didn't know that was a good part of stress. So if stress is good, and so why do we care about stress? Why does it kind of affect us in a way we don't like?
That's a very good question, actually. So, you know, stress, right, acutely, is not a bad thing. And I said that before. Now, for example, let me give an example. If you're driving a car and all of a sudden someone just comes and just takes on and just kind of, you didn't see a car coming and you just smash and just slam on your brakes, that's because at that moment your stress response caused that action where you're not thinking about it 2 minutes ago or 2, 3, 5 minutes ago. But because of that neurotransmitters that is released right away, we can actually respond right before even kind of recognizing that we did that. So that is what stress can do when it's acute and when it's a physiologic thing, right? When it's just there for that time. But with time, stress can become detrimental to our health. Now we have different kinds of stress. We have acute stress. We have like episodic acute stress. We have chronic stress. So when we have acute stress, for the moment, it's not a bad thing, but like with time, it can start to cause a lot of things. One, when we have neurotransmitters being uprising all the time, we get our digestive system changes, and so we can have GI symptoms. We can also start to realize that, oh my goodness, I'm having all the time palpitations, my heart is racing. That's usually sympathetic nervous system acting for acute purposes, but when it starts to happen a lot, it becomes a problem. People can have high blood pressure. People can start to realize they're depressed. They are more anxious. They're always irritable. They're always angry. People can start realizing that, oh my goodness, my back always hurts and tensing. My muscles are tensed. People can start feeling like tired all the time. Weight gain, all these things is what with time, when your stress levels are high, these things are supposed to be there for a short period and just relieve or go away. It's not gone, it does not go away, and so starts causing problems. So that's really one. I mean, I will talk more as we go about symptoms or signs of stress. So that's why it's not a good thing, because long term it's very, very detrimental to our health. And actually, one big thing that I always like to highlight is it actually increases shortens our age. So it causes aging, because our telomeres, which is normally as we grow older, it starts to chop off from the end. If you think about it that way, when we are stressed a lot, those neurotransmitters cause that to happen so much quicker, and that's a big problem too. Cause a lot of problems, diabetes, and even heart attacks, and more. So it can be really detrimental.
Oh, I see. So if I get what you're saying, we need stress in our lives. Like it comes, it starts. But um, if we allow that stress to continue for a long time, then it becomes an issue, right?
Correct.
And so we have to we need the ability to identify stress when it starts, and identify the symptoms and try to stop it so that it doesn't become chronic, right?
Oh yeah.
Because once it starts becoming chronic, then it affects us in a very bad way. I know you mentioned some of the symptoms of stress, and what how you can identify stress, but can you elaborate more? So how you mentioned GI symptoms. I think I used to have that one. I need to check myself. Yeah,
No, but
yeah,
I
but
also used to have that too. So I have to be honest. Yeah.
yeah, but can you elaborate more some of the signs? What should we look out for when we have stress? I know we still go deep into other things that can cause stress, but what should we look out for? You know, signs that shows us that we have stress. I'm stressed. Yeah.
That's a very good question. And actually, before I even answer that, I wanted to say a lot of times it's actually it can become our usual, or it happens all the time that we don't even know that we're stressed, because it's our normal. It becomes my normal. So that's why it's important to identify and know the signs of stress. So that's why I will take my time a little bit to talk about it. So first of all, I start with small things. So when you start to realize, you know what, I am more distracted. So say you're at work, or even you're at school. In school, you realize, oh my goodness, I can't focus. I'm trying to take a test. I realize it takes me so long to answer the questions. I realize that when I'm studying, I just find myself wondering, things like that. That's actually can be a sign of stress, because our body, like I said, these neurotransmitters, they can cause a lot of decreased ability to focus. So when you start noticing you're having problems focusing, and you find out that you're always wondering thoughts, your thoughts are also wondering all the time, and when you start to also figure out that you are always irritable, or you more than you usually are. Some people are just always upset, always angry. That's who they are. But if that's not who you are, and actually it happened to me 2 weeks or 3 weeks. I think in my podcast I talked about it, where I had to really go and talk to my program director, listen, this is a lot I need, because this is I'm getting upset, and this is not who I am. So irritability, feeling overwhelmed, and depression, anxiety, always anxious. And if you feel like you're not an anxious person and you're starting to be more anxious all the time, I'm starting with just the mind, and we can go other GI symptoms, which I'll get to.
Okay.
But back in the mind, if you figure out, or you find out that you're always feeling down, or even fatigue, you're always tired, you can't really understand why that is. Think about stress. Is there stressors or things stress? Wow. Now, coming back to just the body, starting from even our muscle. So when you start to see you have backache, neck ache, and that's happening more than you're supposed to, or you usually have, that is because the body is always tensing up, and it causes pain, because our muscle, when it tightens a lot, it causes pain. So people can start having back pain, neck pain. Now, migraines is a big one. So if you're the kind of person that does not really get headaches, and you're starting to get headaches more frequently, and with me, I normally don't get headaches, and when I do have them, I know that this is not usual, especially when it recurs. Now, another big thing is the GI symptoms. So people can, like me, I remember when I was in my first year of fellowship, I started having diarrhea, and I couldn't understand why I was having diarrhea because I never used to. And I figured out later, oh wow, that's why, because of the diarrhea, because of stress, I mean to say. So some people also may notice that they have constipation. They're very constipated, and that's not normal for them. And people can start having like irritable bowel syndrome. They say maybe I've had patients that go to the hospital frequently, and they can't find out why they're having all these weird GI or bowel changes, and this can be stress related. Another big one, which I always like to highlight, is palpitations, like your heart always racing for no reason, especially in young people. But I've seen that more and more at work, like people like 18, 19, 16 coming in with palpitations, and we walk up or do all these other tests, and everything comes back negative, and we realize later that's the stress in their lives that are causing it. Another thing is high blood pressure, like I said, stroke, and even in young people now. I think I was talking to you about it a while ago, that even in young people, they're starting to see young women in their 20s, 30s coming with what we call spontaneous coronary dissection, where they have a heart attack. They come in, they feel like a heart attack. Their chest is hurting. They are like in a lot of pain, and you take them to the cath lab, and you see that there's no blockages, but then they have this dissection in their artery from stress. Another thing is what we call broken heart syndrome. People can have from a lot of stress or something that happens acutely that causes a lot of adrenaline rush, and people can have even a heart attack. Young people too. And another one that I can tell is aging. And one of that big thing is I always try to highlight is weight gain and weight loss. Some people can, because they're stressed, they eat a lot more and they gain weight. Some people they eat less and they lose weight, right? And another one that I just remember just now is people may start procrastinating. They're sleeping more. People can have insomnia where they sleep. They can't even sleep. They can't fall asleep, right? So it's a lot. I think dizziness and lightheadedness is a lot of things that can cause stress.
Oh, wow. Yeah. Wow. Thank you so much.
And I'll
Thank
remember
you so much.
to go along. So sorry.
That is a lot already. In fact, that is a lot. In fact, I should put my dictionary by my side. And I want to tell those online, if you have any question, please feel free to ask. You can drop your question on the comments. Just type in your question. I'll be able to see it, and then I will ask our guests. So please feel free to comment. Maybe you have something to say or you want to ask a question. Please feel free to do that. One thing you said, doctor, was talking about young people now coming into the hospital with all this I don't want to call those words you call very big words, I don't know what do you think might be causing it. I thought you start seeing high blood pressure from age 40, but these days, in fact, I know somebody, a relative, that right now is taking antihypertensive drugs, and he's just 20 years old, and he's already on antihypertensive drug, and I got so worried, for him. What is happening? Do you know what might be causing it, or what factors might be adding to these people coming down, young people coming down with these symptoms of stress?
Yeah, that's a great question. And actually, me and my attorney were talking about it last week, because we had a patient. Actually, she had, in the last 3 months, she has seen about 3 patients who were getting kidney transplant, because they have had high blood pressure for so long that it affected their kidneys, and they're like in their 30s and 40s. So it's actually getting worse. And to be honest, the fast pace of life and the stress that young people are dealing with now, that we did not have to deal with years ago, is a big factor. I mean, young people now are having to deal with a lot of peer pressure, having to deal with not just the pressure at school, but from their parents, and even from from their peers. They want to fit in. They want to look a certain way, have to act a certain way, or they are supposed to be in a setting. There's a kind of fixed added behavior that people feel like they need to have, and on top of that, they have to focus on doing well in school. They have to kind of be good kids to their parents, and sometimes even kids deal with even homelessness, or running from one home to the other, or other factors, right? And then you start to depression and anxiety in these kids, and blood pressure goes up at such a young age. And so that's hypertension, and people using substances now, substance abuse, like more drinks and alcohol, or now starting to do drugs, cocaine, heroin, and those things affect the heart, right? And so
Yeah.
at a young age, people are getting kids or even teenagers or even young adults are coming in with high blood pressure, which they never had to do, which I mean, we saw before when it's such a small amount. Now it's so much exaggerated. And honestly, I think about it, and I even worry about for my kids, because I feel like there's so much that they need to, they have to, or they have to face that they never faced, or we never used to face years ago. So that is a really big problem.
Yeah, yeah, that's true. Now, you mentioned a lot of factors, from school to peers to parents to financial issues, a lot of factors affecting our young people today. But let's go to maybe school. Let's pick school. I know a lot of young people are dealing with so much academic demands. And sometimes, not just when I mean young people, not just teenagers, some young people too, trying to figure out their career, what path to follow and which way to go. Can you just give some advice to that group of people, they have so much in school to do and trying to balance everything? And before you even answer that, I have one of the youths I used to mentor, and she had spring break. She told me that throughout the spring break she did not do anything. She just slept throughout. Like, she slept for a whole week. She was just sleeping, And I think it's because of stress, right? I think she must have been, so much stress. But what advice can you give?
Honestly, I think one big thing that I've been reading and trying to study about this is, I think we have unrealistic expectations. That's one big thing here. We feel like, oh, I need to please my friends at school. I need to do this, I need to do that. And so a lot of times they're not realistic, and sometimes they are not relevant. Let me kind of explain what I mean. What I mean is, sometimes we feel like this is important, that we are good at choir or music. We are also good at our schoolwork. We have the best in school. We have to be the best in basketball or sports. We have to be the best at church, in whatever activity you get involved in. And we want to do the best we can. But I think it's focus, and focus on the important things. So you have to ask yourself, okay, am I all over the place? Meaning that, so going back to that, am I all over the place? So where is it that I am focused on? Am I focused on too many things that I end up being just overwhelmed? And so it starts to add a lot of stress. So say, what is one thing that I love to do, or I'm good at? Okay, in school, for example, I mean, maybe I'm in high school, and what is it that I love to do, and what is it I want to do as an adult? And I'm not saying that you should not do our best in other aspects of our academics, but saying that you focus on what you really love to do or what you want to do, and give you 100%, and the other ones, do the best you can. However, do not set unrealistic expectations that you want to do the best in everything, but you have to kind of tailor your thoughts or your attention and what's the most important. Same thing comes to anything else. So do not do so many things at the same time, and do not seek for approval from everyone. So I think our youth of these days, we are on social media all the time, and we see things on social media, and so social media give us this reality that is really not real, right? And so that even as kids get older, they listen less to their parents and more to what peers are saying, more to what they're seeing on social media. But I think is having to sit down and ask yourself, what is it that I am doing, and why am I doing what I'm doing? So are you having your focus on so many things just because this person says that, or your other friend is doing that, or are you doing this because it's what you really want to do, right? So that's one, I think, is just being for once very, very honest with yourself about what you really want and why you're doing what you're doing. Are you doing it because this is your friend is asking you to do it? And trying to figure out who, I always say, find a mentor, find someone in your life that you really look up to, and be honest with them about what you're dealing with. Are you dealing with anxiety about A, B, C, D, E? Find that mentor in your life and look for friends who would help you grow. So I think it's really, I mean, it's so hard these days. I can't, if I was a kid, I mean, and a teenager at this age, I would be scared because it's so much pressure. But I think
so much pressure.
most of them are not realistic and they are very unreal. So just being real about and finding people to show you the way, because of course we are still learning. Someone that has been on top of you, maybe someone that is 5 or 6 years ahead of you, that has done this and walked this walk, even 10, 20 years ahead of you, but you can relate to. I think that's really important.
Wow, wow. Thank you so much, Doctor. You've said a lot. You've said a lot. You've said a lot. One, if I try to summarize what you just said, that don't take too much on yourself, right? Because that is one of the issues I see with young people. They try to do everything. They try to be in basketball club, choir. They have, African student club, American student club. They are everywhere. And they break down. So I like that. I like what you said. And these days, in terms of social media use, Instagram, TikTok, I know a lot of young people and they've left Instagram now. I'm sure they're on TikTok. Yeah, they're on TikTok now. And in fact, they are leaving TikTok, going to another app that is coming out. I'm hearing that Lemon 8 is coming out soon. That is a new app for young people, and they are getting on there. They don't want to stay anywhere parents are, but the issue is that when you go there, like you said, unrealistic expectations, you start seeing people, and most of these pictures or videos there are using filters, right? Are using filters. They don't have their real face. And for example, I can see your real face and you can see my real face, right? No filter. But most people and these youths are running after shadows, and they get so stressed out. I know you've said some things about peer pressure, but do you have any other thing you say in terms of that? How you advise young people, because it's a big deal, although I like what you said about mentorship, having somebody you look up to that will guide you, but say something more about peer pressure. How can they deal with peer pressure?
I think for peer pressure, it's difficult to actually honestly tell a young person that what they're being told or how they should. Or so the problem or the issue is, I think they're perceived ways that people feel like their friends are telling them to act or to express or things to do. I think one of the reasons people go in peer pressure is actually low self-esteem. And that is something that I think no matter what you tell someone who has a low self-esteem, it's very difficult for them to see out of, or to see, to do, or to get over, or be able to overcome peer pressure. Because I think once we figure out that we want to get accepted, acceptance is a big thing. We all want to get accepted. It's not something that I would sit here and tell you I don't want to get. Everyone wants to get accepted and feel heard. So that's one of the things, as we grow up, we want to be heard. We want to feel like we matter. And so it's almost impossible for you or me, if we're looking for that that encouragement from a certain set of people, our friends, or those that we hang out with, to not be that way, except we trust that we are enough the way we are, right? And so I always say that one thing is look for the friends that will kind of encourage you to be who you are, and to understand that you are beautiful the way you are, and what in self-love, in self-respect. Again, I always say, when you notice in your life that you're not happy with who you are, you have to ask yourself, is it a true thought? Meaning, what I mean. So if you say, well, I don't like myself because I am doing this and this and this wrong. Is it really a true thing? Is it really true? Or is it just because you feel that's how other people feel about you? So I think it's being able to analyze and see whether you have problems with your worth and self-worth. And that's something that comes from within. So I think that I suggest or I recommend when I talk to people that I notice are dealing with peer pressure, I say to them, what is it about what you're doing, and why do you feel the need to be that way, or why do you feel the need to want to do what this person or these people are telling you to do? Is it because you think it's the right thing, or because you want to or you feel accepted? And I think working with yourself or within yourself, finding someone that can help you grow and accept you for you are, knowing that you're beautiful, is not something that comes very naturally, to be honest. But I think work on is a big thing too. So peer pressure to me is difficult to deal with if we have our inner struggles with who we really are. So I think when you see someone struggling with peer pressure, the question is, does this person really understand or trust or know who she or he really is, or they are just not comfortable with who they are inside? Sometimes, to be honest, as kids growing up, we don't know what we really want, and peer pressure is there. But I think I say, even if you're not close to your parents, which I think you should be, if you know your parents care about you, there's some things here and there. But I know we have our thing, we want our corner, we want to have our space where our parents are not in that space. I get it. But I think just be able to find someone, even if it's a friend that you trust or someone that's older than you trust, to be able to be vulnerable with. And that can help a lot.
Yeah, great. Thank you so much for that. Somebody commented, Peachy X Girl 13 said, agreed. Also remember, everybody doesn't wish the best for you, so be careful that they are true friends. Great. Yeah, that's a wonderful comment. Wonderful comment. If you have any question, please remember you can just add your questions on the comment. I will take your question. Yeah, thank you so much, Doctor, for that response. Now let's shift a little bit. Let's go. Okay. Before I shift, I wanted to say that it's also worthy to note that peer pressure doesn't affect just teenagers. It affects everybody, right? As you grow, yeah, you might be able to deal with it better, but you also have that pressure, okay? Yeah, with your peers, because sometimes when we say peer pressure, people think it's just about teenagers. I remember when we bought our house, I had peer pressure. Uh, what caused the peer pressure? I was looking at my lawn and comparing my lawn to my neighbor's own. It's not green enough. I'm like, I sit at the window, I open the window, I look at what others are doing. They're adding flowers, they're adding this, and I'm like, what am I doing? Why am I not adding something to my lawn? So peer pressure can affect everybody, and like you said, it's very important for you to know who you are, know what you want, and have a goal and have a focus in life. Great.
And
So
one
let's
thing
shift.
I was also going to add to that is,
Yeah.
sorry.
Continue. Yeah.
I think in life we try to compare ourselves to other people, and always, and something that I remember that stuck to me that really helps me a lot, not just helped me, is that I always say that people that are always on your case or trying to kind of give you or brag or always, I feel like if you really are happy and content with who you are, you would feel you do not feel the need to be loud. So people that are always bullying other people, that are always talking negative stuff about you or that person, if someone comes to me and is so negative to me, I feel like there's something that they are trying to hide. So that's why they are so loud. So I feel, always remember that a lot of the times people that are, when people start to want you to be a certain way, they also have a problem with themselves. And that's why they feel the need to kind of exaggerate and make you look like you need to change who you are.
Thank you so much. Thank you so much. And PixGS girl, thank you again for your comments. Know that others do not validate who you are. We should validate ourselves. Thank you so much. That's very correct. That's very correct. Now let's shift. I know I have a lot of friends going through the medical training, and And it's one reason why I brought you in here because I know you might be able to relate with them. And some of them have gone through a lot in terms of, writing the exams, having to not matching, the year they were supposed to match, and they are waiting and they are so stressed up. So how would you advise? How would you advise them? How would
That
you,
that's
yeah.
that's a very good question. To be honest, people that do not do medicine do not understand. It's
Mm,
really, really hard because medicine is it's very difficult. And so in every aspect. So medicine
mm,
study so hard. You sacrifice so much. A lot of people are doing other things and you're studying, you're reading, you're doing here and there.
mm,
Not you kind of sacrifice everything else to be there. Financially, you give a lot of money in the front end, get loans
mm,
and things like that.
mm,
Sacrifice, spend time with your family, your parents, your siblings, if you are married, your kids. And it's just a lot. And so if you get to a point where you're looking forward to the next step, and to get to the next step is passing your boards, right? And you
mm,
don't, it's very devastating. And to be honest, it happened to me. So I am
mm,
saying it because grass was always greener. No, it's not.
mm,
So I think that for me it was such a difficult time because I remember, and luckily I just got married, and I think that I was so anxious all the time.
mm,
I used to cry a lot. I was very very I started palpitating then a lot, and I started to realize that I was not focused. It was so much that was going on with me. I lost a lot of weight. People were wondering why I lost weight.
mm,
But I think that one thing that I always say is try not to focus on what has happened. It's good to kind of figure out what did I do that I should do better next time. So, I mean, the year comes, there's a match day. If you do not match, then you have a week after where you do what you call like a scramble, or where you kind of see if you can fit another program that did not completely get full. And if you don't match, then you kind of have to wait the next year, right? And
mm,
during that period, it's a very hard time, especially the first few months, because then
mm,
you see a lot of your friends, the people that you know that have matched and they're moving forward, and you feel like, oh, everyone's kind of moving on and I'm still here. And you're scared, first of all, one, would I even ever match? And what's going to happen? My life is screwed. It's not like medicine is, sorry, that it's one path, right? If you
mhm,
do not match, you don't really have anything in between where you can go and say, okay, especially in the US, practicing as a
mm.
doctor, it's really hard to do something else if you don't have that board certification. So it gives
Yeah.
you a lot of anxiety. Like, okay, what if I don't match next year? And it's even harder next year, probably, to match. So then
Mm,
it's much, and then, okay, now maybe I have to pay my loans. What am I going to do? It's so much anxiety with that. But what I say is, first of all, you ask yourself, one, what is it going to benefit me just loathing in exactly what had happened in the past? Okay, start thinking, okay, should I have done A? Should I have done B? And if I did B, what would happen? All this trying to go back and look in what had happened is not beneficial.
mm,
So I would say sit down with someone who has done and gone through the process, talk to them, be honest and tell them, look, listen, this is what I did. I don't know if this was the right thing, but this is where I am. And what do you suggest based on your experience? And they will
okay.
give you advice
Mm,
so that you can plan for the future and say, okay, in the next couple of months, maybe I need to, one, it's very important, I always say, to keep in doing something medical, observership somewhere, or, maybe working, shadowing with some attending or a clinic or something clinical where you can see a PhD or even MPH program, something where you can still be in it, where you have to plan that next couple of months. What am I going to do to give me a better chance to kind of increase or better my resume, right? My CV for the next time. And honestly,
okay.
connect with people who have matched, who are in residency, because they are your help. I always say, unfortunately,
Mm,
the medicine system is very, especially as a foreign medical graduate, to get to match is
mm,
very difficult, even when you do really well in the steps. So I
okay.
always say, try to find people who who are either doctors, graduate attendings, or in their fellowship or your residency, who you can talk to or connect with and see how they can help you, maybe put in a good word for you, maybe you can work with them. You know what I'm trying to say? So that's second.
Mm-hmm,
One is don't loathe in what had happened. Talk
mm-hmm,
to someone who have been through it and see where they can advise you on what you do differently the next time. And
okay.
three, try to kind of figure out some clinicals or something to do that can help you fill in those gaps or keep your resume still active. And four, try as much as possible to connect. Connections in medicine is amazingly important. I cannot emphasize it. And try another thing to find something you love to do. Do you love to dance? Find a dancing class to join. Okay, you love yoga, do yoga. You love to, whatever it is you love to do. And people doing that can try to isolate themselves. That's the big mistake. Do not do that. Do not do that. When you isolate yourself, you are giving yourself such a horrible thought, self-esteem about who you are, and it kind of brings you down and makes yourself. So you're gonna interview again next year. People, I interviewed for 3 years when I was a teaching attendant, and when people walk up to me, I can tell, I can see just when they talk to me how they feel about themselves. So when you look in your failure, it actually makes you believe that you're a failure. And with time, even when it's all past, the next year, people can still see it in your interview. So I think talking to people, hanging around people that have fun, that you can do fun things with, are important, so that positive vibe can keep you going during that year.
Great. Wow. Thank you so much. I believe you've given them some very wonderful things to take home and apply to their lives. Now, let me still around that topic. Well, not just for medical people now, for adults or young people working, and they are going through a lot of stress in their workplace. I don't know if you've had any personal experience in regards to that, stress in your workplace. How did you handle it, and how would you advise people to handle that?
Well, work these days is people are giving us small work to do, because it's just it's funny. People want more for less, and not only that, just things are growing and no one wants to expand. They want to keep what they have to get more. So what happens? That increases, and especially if men who work in very busy or kind of challenging jobs want to still feel like they're doing a great job without complaining. So a lot of people feel like they can take on more. So they give you more, like, oh yeah, I got it. They give you more, you say, I got it. And so until it piles and piles and piles. And we're women, we are sometimes in a place where we are, how I put it, it's dominated by men. And it's not a bad thing, I'm just saying. Then it starts to, and you have kids, you take care of, you have other things and responsibilities. Even the men have other responsibilities, and it becomes so stressful. I in my own personal experience, and even as a physician, always say you have to know when to ask for help. Meaning that when I start, like for me, my job is very stressful each day, every day. Cardiology is so stressful. I mean, I can tell you. But and then I have kids, and then I'm married, I have kids and stuff. So that's another one on his own. And I started to realize that I was just going on doing the work, and trying, what can I do? It's what it is. This is what it is. And I started to realize that it was really causing me. I started having 2, 3, 4, 10 symptoms of stress, and I had to just pause and go to my program director and say, you know what? Maybe you think this is weak, but you know me. I work hard. You know me very well. This is too much. I can't do this. I'm snapping a lot at my nurses. This is not me, and I don't like this. So I feel like one is recognizing the symptoms of stress in your life. It's really important. Am I having diarrhea now? I don't used to have diarrhea. Am I always getting so frustrated with people, snapping at people? Even those little things, you start to realize that it's building. You have to take a break. And one thing I always do is I do what we call it practice mindfulness. So like for example, last week my page, I was just going off and off and off, and I was like, I didn't even know what to do. And then my resident turned to me and looked at me, and I didn't know what to do, and I did I did it 3 times, 3 big breaths, and he was looking at me like I was crazy. I did it 3 breaths, and I was just pulling my neck as I did that. And you know what? That made a lot of difference at that moment. So even at work, when you feel like you're just under it, just take a deep breath and just take those deep breaths and sit well, and just take the deep breath there and then out. And sometimes I just move my neck while I do that, and it helps a lot. Another important thing is exercise. So exercise. We recommend 30 minutes for 5 days in a week. But I'm gonna be honest with you, I can do 5 days a week. So I try to do my exercise at work, honestly. But usually, if you can, exercising fine. Even if it's walking, take a walk. And my husband actually used to do this, which I used to join him before. I just don't have time, but he used to go online, and this very funny, like they have instructors. It's fun. You do it just for fun, but it releases a lot of stress. Another thing is trying to be careful what you eat. It's a big thing. So try to be supposed to do more nuts, more like lean foods, and try to avoid coffee, because we try to go to coffee. That's what we grab, coffee, so it gets through our day. But guess what? It increases our palpitations, our heart rate, and all that things like that. So less coffee, drink more water. And another important thing I always say is try to journal. I journal. I really do.
Oh,
When my day off, I journal. And it's so funny because scientists have noticed that when we journal, we actually express our thoughts and realize our hidden stress that we can relieve just by writing. So when we write, we relieve our stress by doing that, okay? That's a big one. And try to, if you notice you're not sleeping well, try as much as possible to sleep more, okay? 8 hours at least every night. I haven't been doing that because I just can't, but I'm trying to catch up whenever I can. So very important. And one last thing before I forget is try to find someone that you trust to talk to. Find that body that you really trust to talk to them. Because honestly, I always say that it's very important to be able to release. Release is not a sign of vulnerability. It's not a sign of weakness. Find that person that you can talk to about your struggles, or if you're really mad at work and you want to just explode, just take a 2-minute break and get out and find someone that you know, or call your friend that you know is very helpful to just talk to. They may not say anything, they may just just listen, but that releases a lot of stress. And at work, when you feel like you are about to break, meaning that you're about to maybe slash out at someone, just go to the bathroom, look at yourself, and talk to yourself. That's important. That communication is important. Helps a lot.
wow. Wow. Thank you so much. Thank you so much for these wonderful tips. The only one I'm scared of is exercise. Now, I'm sure my wife is online and she has been begging me to exercise. She's going to come at me after this.
He's
After
right.
this live stream, she will say, I told you you should exercise, and see, you're not exercising.
She's great. You must know that she loves you very much. That's why she's honestly telling you.
Well, I'll try to do more of exercise. Well, that is good. Thank you so much. Thank you so much for that. And please, if you have any question, please, we have about, let's see, about 13 minutes more. So you can please ask your question, drop it on the comment, and we'll see how to answer your questions. Let's go back a little bit to the teenagers. I know one of the common stressors among teenagers is relationship with their parents. I've mentored some very young, a lot of young people that have issues communicating with their parents, or issues with their parents. And in fact, one went into depression. Another one had suicidal thoughts. So I've had issues like that. What can you say to that?
Wow, that is deep. And honestly, I think as we grow up, as we get older, like, so they say at about age 10, kids start to move away from their parents, and they not that they distrust their parents, but we I just say we as people start to rely more on things outside as a better gauge of how they're doing, or the self-worth, as opposed to what the parents say. So what ends up happening is, as we get to the teenage age, 16, 17, actually 14, 15, 16, kids are lost from their parents, because now their parents are either just have given up on them because they feel like they can't get to them, or the kids have found another niche where they feel comfortable with. Now, sometimes it ends up being that they get back. So they may get back in some way, but some just get lost in the process. And sometimes the parents are, how I put it, are not close to their kids anymore. So they have that gap. I say, if you're listening, and I hope that you will take this to heart and really think deep about it, is that you need to understand, especially if your parents have shown you that they love you. Now, we're not perfect. We make mistakes. So your parents will not be the best mom or the best dad out there. But if you know that they care for you, it's important to be able to try to bridge that gap somehow and to understand that, yes, it's okay to have your differences, of course. And actually, I'm talking to parents here as well, because I'm also learning. Is that as our kids are growing out, and look at my son, I see how he sometimes thinks, they're going to kind of have their own opinion, and they're going to have they're going to grow into themselves with time as they go. I think what we call grace, to be able to understand that they're not going to be 100% who you want them to be. And your parents are going to tell you what they want you to do, but trying to find that balance, that fine line where you're going to, one, understand that they care, and figure out if you are the kind of person that has gone away from them, to try to step back into the circle, to be honest with them about where you are and what your struggles are. Because I think that the biggest thing that happens is kids go out there and they realize that the life that they were looking for is not what they have, and they can either be able to be honest and humble enough to come back, or just find another way because they don't want to come back in real and honestly say, oh, I made a mistake. So I think one thing is, please, as a teenager or someone who you know drifting away from your parents, to try to see how to get to discuss with your family, your parents, honestly, one-on-one. And if you have a mom or a dad who you feel like do not really care, to kind of see whether you can find a mentor that can help you to be to get back to who you want to be, or help you find your way back. Other thing, if you feel you're depressed, or you have suicidal thoughts, or you're feeling in a very bad place, you may talk to a counselor. Find a counselor at your school, or someone that you know that can help you get back. Because sometimes teenagers can be so far gone that they feel so depressed and they may want to hurt themselves. And so just being able to find one person to talk to them about how you're feeling helps a lot. And as a parent, I beg you to not give up on your children. Sometimes it's easier to just let them go because, oh, they're grown up now, I can't do anything for them. Try to have a middle ground where there's compromise. So compromising with each other. Your parents will compromise with you, you compromise with them. So as a teenager, compromise. Try to find a balance where you can meet them halfway, you know, and understand where they're coming from. So that's something I'll recommend.
Wow, thank you so much. Thank you so much for that wonderful response. Once again, if you have any questions, please put on the chat and we'll be able to answer your question. This will be like the last question before we go. We've talked a lot about stress and common stressors and what, different groups of people can do, the signs and symptoms of stress. But what about those that already see these symptoms, like they're already down with high blood pressure, they're having a lot of things going on in their body as a result of stress that have accumulated over time. What will you advise them to do?
Honestly, I always say, if you feel like you're having changes in your body, so for example, say you have high blood pressure, you realize that your blood pressure is high, seek medical care. I don't think it's some people say, oh, well, I will do this, I'll do that, and it will get better. I say always be able to know when to call for help. So if you feel like, okay, I don't understand why, but I'm checking my blood pressure, or I've been having headaches a lot, you should go see a doctor and find out where you are. Are you really having these headaches because it's maybe you're having high blood pressure, or you're having a headache because of stress, and maybe you need to do this and this and this to combat that? I always say eating right. Like as we grow, as we get older, our muscles and our vessels also stiffen, and it's very easy for us to develop high blood pressure even with the stress of life, because as we age, that ability of our our blood vessels to dilate is less, and so people can have high blood pressure. So seeing the doctor at least once a year, doesn't matter how old you are, whether you're 30 or 40 or 50, see a doctor once a year at least. And if you feel like you're having the symptoms that are not normal, like palpitations all the time, you feel like you're about to pass out, you're dizzy, you should ask to see a doctor and see what they say about that. Whatever they recommend, I would strongly recommend that you take that seriously. If you are significantly depressed and you sometimes people, as a physician, I've seen a lot of things where patients come to you and they look good. They look really nice, and they sit with you and they start talking, they start crying. You realize, oh my goodness, they're in deep, deep depression. So people can come to you and look good, and tomorrow they're dead. So what I say is, it's really important to be honest with yourself. If you're going through depression, please, please, I'm begging you, ask for help. There's not this, and we, especially as Africans or even Black people, we try to kind of toughen it up. You know, we don't want to tell people it's we are going through stress, we are depressed, because it's like a stigma. But honestly, people that are able to talk about their depression, they are heroes, because that is recognizing is the smartest thing to do, to speak to someone about it. So I'm begging and asking, if you're depressed, you're anxious, you feel like you're going through something and you need help, you have to ask for help, and hopefully get that help. And if you feel like you can get it here or there, reach out to people like us who can help you, connect you to someone. And honestly, I'm going to say out here is that I'm willing to do anything I can to help anyone with anything they can. If I can help, I'll refer you to someone who I know can do this for you in a very discreet manner, so you can see to go with your life and feel like you are still not you don't feel like you are violated, or you feel like you are not, or people know what's going on with you. So that's important.
Wow. Thank you so much. Thank you so much. Dimochi said awesome nuggets. Wonderful. Thank you so much. And yeah, you can reach out. And if you want to reach out to Dr. Osawe, Instagram handle is Dr. Osawe Small Bites, right?
Yes, so Dr. Osawe Small Bites, correct.
Yes, and she deals so much about stress. She's educating people about stress. So if you have any question, you want to talk to her personally, I'm sure she will help you, and she will direct you to the right place where you can get help. We have one question from Beverly Campbell. She said, how do I start saying no when I feel overwhelmed?
Oh my goodness, that's a great question. I love that question. Actually, I have that problem. I really do. You know what I do? I always say nicely. And this is the phrase I always use. Thank you very much for the opportunity. And it means a lot to me that, you know, you really saw and thought that I would be very well fitted for this. I'm just giving an example. Say they asked you to help with something, you know, I really thank you for the opportunity. But at this time, I would not be able to do it because, and you can tell them why, if you have to, if you feel obligated to. But I think you need to thank the person for the opportunity and be able to say, but based on the fact that I'm occupied, I will not be able to do it. And it's been helping me. That phrase goes a long way. You thank them for the opportunity and you say no. And honestly, no is a hard thing to say because we feel like we are not capable, we're not enough, or we are not. You know what I mean? It kind of makes us look like we're not doing enough. But again, it's actually part of our strengths. Yes.
Yeah. I learned to say that too, and I'm still learning to say that because most times you know, you just want to be there for everybody. You know, you want to help everyone, but I'm learning to say no too. I'm like, I'm sorry. I would have loved to help you, but at this time I cannot help you. But that it's like you said, it's a strength to develop, learning to say no. Thank you so much. Thank you so much. Timothy said, no doesn't mean never. It means not now. Thank you. Yes, I like that. I like that. It means not now. Yeah, I mean, it means I cannot help you right now, but I can help you later on. Thank you so much for that, Timothy. And I thank every one of you for joining us online today. Thank you for being part of this discussion. Thank you for your comments and thank you for your questions. Do we have any question? Last check. Dimochi is still commenting. We should never feel pressured to say yes, else it could backfire. Yes, yeah. Esther is saying, thank you, Dr. Osawe. I learned a lot. Yeah.
Thank you so much. And I wanted to also add, if you have any questions about anything that is personal, you can always email. So what I will do is, if you go to, maybe I can also put that in a comment. You can either go to osawesmallbites@gmail.com or faithfulosawe@gmail.com. Just send in any questions you have or any help you need. And if you're on Instagram, you can always, I think there should be, or a small, that you can send a personal message. You can always message me, and I will always be ready to help wherever I can. Okay.
Yes, great. Thank you so much, Dr. Osawe.
Yeah.
And thank you everyone for joining. Have a great
Pastor Chukwu
evening.
for getting me involved. Dr. Chukwu really means a lot. I really do appreciate this opportunity. It means a lot.
You're
Thank you.
welcome. You're welcome. Have a great night. Yeah.
Thank you.
Bye.
Bye.